Hello, everybody. Welcome to the first video summary of the Biobusiness newsletter. My name is Adrian Rubsten and I'm here with Gustavo Carrizo. The main idea from this video is for you to get a quick overview of what's going to be the next topic for the newsletter coming out on Thursday and to have some more information before reading it. Our week's topic for the newsletter is going to be Nash.
So Nash is a very serious medical condition, and its prevalence is rapidly growing. And this disease is characterized by the accumulation of fat in the liver and also inflammation. It can lead to fibrosis and sometimes cirrhosis in the liver, but also it can increase the risk for cancer. So even though there's been decades of research to try to understand the mechanisms that are causing this disease, there is not an approved therapy that can really modulate fibrosis, which happens with the disease, but also to try to improve the clinical outcome in patients. And what is interesting as well is that the current detection or the way that we stage liver fibrosis is still biopsy. And the biopsy is a very invasive and resource intensive approach. So there is not only an unmet need for the patient to get a drug that they can really benefit from it, but also there is an unmet need for developing non-invasive and diagnostics for this disease. And so the question now is like, what are the current drugs that are in development? And also, what can we learn from the ones that we know that already failed? So in this sense, Adrian is going to tell us more now about what's coming tomorrow in the newsletter and a little bit more in detail.
Yeah, sure. The main idea is to learn from the mistake from the past, right? And we've seen more than 20 or 30 compounds failing the primary outcome in phase 2 or phase 3. And that's giving us some ideas of understanding if we are right now getting the primary outcome that we need to understand if the patient is getting better or not, right? Just to name a few, it's simtuzumab or elafibranor are compounds that have a huge value, but it fail their primary outcomes, so we're discarded moving on the pipeline. And we are right now seeing more than 100 new compounds with the sponsors that come from big pharma, medium pharma, and startups with different mode of actions from GLP-1 agonists, galectin inhibitors, PPAR, you name it, there's a lot, probably 20 different mode of actions. But if you're asking us, which are the most promising compounds or most promising treatments on the market or getting into the market. Up until May this year, we will tell you there are two companies racing head-to-head. One was Madrigal Pharmaceutical, nothing related to the beloved movie from Disney, and the other one was Intercept Pharmaceuticals. But in July, a couple of weeks ago, the FDA said no to Intercept, stating that they need more information for long-term outcomes. So our hopes relies on Madrigal Pharmaceuticals and their compound resmetirom, that it's probably going to be on the market pretty soon. They just ask for an NDA and a fast revision for approval, right? So do you think that it's all that it's going to be on Nash? No, not even close. As a matter of fact, the investment keeps piling up. You know, there's investors like Orbimed, there's also Vivo Capital, Samsara, Deerfield, you name it, right? Pfizer is also investing. There's millions and millions of dollars trying to reach out this blue ocean that it's going to be close to $50 billion, according to the CFO from Madrigal Pharmaceutical. So there's a lot of things going on, not only on investment, but also on the agreements that big pharmas are doing with other companies. Just to name a few, you have Novo Nordisk and Ventus, in which Ventus licensed a new technology that could be a new treatment for Nash. There's also Path AI and JSK, or Emo Shields and Takeda, in which the first one license, or it's an agreement, strategic agreement for the biopharma to work on their platform to try to increase their capabilities for drug discovery. But right now, there's people trying to understand how the future for Nash is going to look like, and we don't actually know. You know, there's new mode of action like gene silencing on long RNA. So there's a lot of things going on. Probably what most of the pharma companies or investors are looking for is it's going to be a solo therapy or it's going to be a combo therapy to increase the probability for the patients to be treated, to improve the fibrosis and probably not getting into cirrhosis, right? So I hope that you find it informative. And that you will read the newsletter that is coming out tomorrow. If you want to know more about it, you can subscribe on the newsletter link that is going to be on the first comment just below here, and you can always DM us if you have any questions or comments. Talk to you soon.
Thank you.